Hi, I am Ritu, and from Adventurize, this is Venturing Beyond, a podcast where we delve into the career stories of ambitious individuals. And today we have with us Urvashi Prasad, who is a senior public policy specialist at the Office of Vice Chairman at NITI Aayog. We chat about career opportunities that COVID 19 brought to the forefront, the plethora of career options outside of studying medicine that exist for individuals interested in biology or life sciences as a subject, and what it's like to be working in the public sector. We also dive a little bit deeper into her decision to move to India after spending several years in the UK and her experiences being involved in the World Health Organization, the World Economic Forum, and the United Nations in various capacities. Thank you so much for being here, Urvashi. I'm really excited to talk to you. I have like a whole list of questions prepared, so I'm really hoping to, get through them in the next hour that we have. And I'm especially excited for this conversation because, like I mentioned on the call the other day as well, you are like our first guest who has worked in the public sector and for governmental organizations. Everyone we have had so far has had a very, corporate life perspective. So good to
Yeah.
have that kind of diversity as well. Talking about, your work in public health and what's been going on in the world the last year and a half. I'm pretty sure your role as a public policy specialist and working in public health specifically was quite pertinent in how the COVID 19 situation was tackled, right? It was obviously unexpected. So, how did you wrap your head around that? And when it had just started, how did everything around look like?
Yeah, I mean, it came, of course, completely unexpectedly, in terms of work-wise. And I mean, personally for me, it meant that I never really went into lockdown. I had to keep going to the office. I had to keep doing my work. So I haven't really experienced lockdown and so, as how, many people might have experienced it. So I think that was, at a personal level. And I think it worked well for me because I'm not sure I would do very well with myself if I was put under lockdown. So, but yeah, I think the work was it was really interesting at one level because obviously you worked in public health, and I think when you work in public health, this is always something which is sort of a fear at the back of your mind that something like this could happen literally any day because you are very aware of how things are going on, and much more than the average person who's not coming from this sector. So it's like something that you've read in a lot of your textbooks, you've done case studies, you've thought of this often, and here's it happening in real life. And so while it's like, okay, this is also my worst sort of fears coming true, it's also a great opportunity for somebody who's trained to be a professional in this space, because here you have the opportunity to contribute to obviously one of the worst sort of health crisis at this kind of scale that the world has faced in I would say probably 100 years or so I think that opportunity was also huge. Obviously, the role again being at NITI Aayog, it was more of a monitoring role in terms of monitoring how different states are doing. What is the data like? So I used to monitor the data almost on a daily basis in terms of how different states are doing, how different districts are doing. Because again, as I said, in India, um, policy making can't stop at the state level. You have to go down to the district level or sometimes even lower than that. In order to be able to really make a sensible decision. So one got that kind of perspective into how do you really monitor all this data, feed it into the planning process for how you plan for each state or each district in terms of what kind of human resources you need or what kind of medical infrastructure you need. But it was, I think, the most interesting part also, and also the most which is what kind of always kept you on edge, was that you had to change every day what you were doing. Like there was no consistency. It's not like you would, yeah, there's certain things you were doing pretty much every day, like the data tracking, monitoring, feeding, but otherwise you had to react a lot to what is happening. If something's happened today in a particular state or in a particular district, and you have to like just immediately react to that. You have to think on your feet. You have to try and reach out to people, resources, even globally, see, what best can be done to tackle that kind of situation. So I think, that real time, sort of decision making and being able to react, that is, I think, also a very, important skill that you learn. And in this case, there was no option. You just had to like go with it and just do it. So yeah, it was a really, really difficult time. It was, it was very, very long working hours, no predictability to the work day at all. So it was all of that. I think at a personal level, I have to say it was very difficult, very draining. I remember like in December last year, I was feeling completely exhausted that, and to think that, the pandemic's not over at all, like it's still very much going on. And, there's no like defined end date to this at this point, but it's exhausting, it's exhausting because, I mean, yes, you're not on the front line. You're not doing what a doctor or nurse is doing. And obviously, hats off to them for doing what they do. But even being somebody in the background and, just having to like constantly be on the ball and constantly be available, and also be using your mind and your resources, your networks, to be able to function at that level, when really there's such a crisis going on and it's changing every day. It's not a situation which is static at all. So I think I would say it's definitely been, one of my biggest learning experiences and a very steep learning curve, very, very steep learning curve.
Yeah, no, absolutely. I can imagine that. I mean, for a lot of us, it came to a point where we had like the privilege to stop reading news or just cut yourself off from it when things got too depressing. But yeah, of course, like you didn't have that option. You had to like face that reality every single day, and that's definitely. You can imagine how stressful that could be. Since you mentioned, looking at it as an opportunity as well to the kinds of things that could happen in the future and the changes that are coming out of it. A lot of people are talking about, adapting technology to an extent that wouldn't have happened otherwise if we had been going with the pace that we were, or just completely switching gears to more efficient methods of working as a workforce in general as well. My next question is sort of along the lines of what career related opportunities do you see emerging out of it, because a lot of professions around biosciences, or just studying things related to that field, weren't at the forefront. We weren't talking about drug development, the study of viruses or vaccines and all of those things on an everyday basis before that. For someone who's interested in studying biology or something of that sort, the very obvious choice is, let me do medicine and let me become a doctor, because that's what's in front of you, right? But there's like a plethora of things that you could do too. So what do you see coming out of this?
Public health is much broader than medicine. And, this sounds like something so fundamental, but it's incredible how many people still genuinely are not able to, distinguish the two things, So for people, healthcare or health is sort of synonymous with a medical doctor or a nurse, and I think just to be able to appreciate that actually public health is very, very interdisciplinary. You equally need a social scientist. We've spoken so much about behavioral change, ever since the pandemic has come. And I mean, for me, working in public health, this has always been something that should be a priority always. You shouldn't be telling people about behavior change only when you have a crisis, only when you have a virus which is, raging across the world. Behavior change is something we need to have in our everyday lives all the time. So you need social scientists for that. It's not a medical doctor who's best positioned to tell you how to do that. In fact, it's not his or her job really. So you need a social scientist over there. You need health economists. You need people who can study the relative cost versus effectiveness of a particular intervention. And we always use this kind of information in the health sector that, if I have to treat a particular disease and I have two options, which one do I go with? As a policy maker, which one do I pick? So I always need to look at the cost. I need to look at the effectiveness. And again, this is the kind of rich and deep analysis that comes from health economists. We need epidemiologists. So these are people who really study diseases at the population health level and tell us, what is the sort of natural course of this disease? What is the way in which it's going to progress? How lethal is it going to be? What it's going to do to people. So we need those kind of professionals as well. So I think that is really the biggest message, and that's something I always give. But I really hope that this pandemic sort of makes that distinction very clear. That yes, of course, you can go down the medical route. You can, do medicine. You can be a nurse. You can even be an allied health professional. So, you could choose to do something in nutrition. You could choose to do something in physiotherapy. Those are also very, very important, sort of professions, even though we often don't put them at par, with a medical doctor or a specialist. But we should, because they also have very important roles that, those kind of professionals play in their own way. But then you can take a completely sort of non-medical route, also in the healthcare sector, and you can say, well, I'm an economist, and can I use my skills in public health, or I'm a social scientist. How can I help people to change their behaviors, towards better health and well-being? How do I do that? So I think that is going to open up, once we have that understanding. Then I think it's very clear that you have a whole plethora of opportunities which are open. And of course, as you mentioned, that also now the intersection with technology, um, especially how do you make sure that, you know you have a very democratized access to this technology? Because again, what the pandemic has also shown, is a digital divide, in many cases, right? So it's not that, um, yes, adoption of technology has gone up, but it's not uniform, right? So in India also, like, while somebody in an urban area might be able to do a teleconsultation, relatively more easily, it might be much more difficult for somebody in a village or in a remote area, right? Or similarly, use of technology in education. While in our kind of homes, we might be able to give our children a tablet, or they might be able to do online classes on Zoom. It might be much more difficult for a child, in a village or in a remote part of India. So when it comes to technology, like, how do you really democratize access to that? How do you make sure that everyone has access? How do you make sure, it's having that kind of impact on everyone's life, and it's not just a few who are benefiting from it, whereas others are getting even further left behind, because that's a danger. That's a real danger. So I think there's going to be a whole host of opportunities that this will open up, once we just have this fundamental understanding that public health and healthcare is not just being a medical professional. There's so many other ways, and there's so many existing skill sets that you might have, which you might be able to actually bring to this field and have a very, very meaningful career. So I think that sort of understanding, hopefully will now come about in a much bigger way.
Right, absolutely. And that's one of our goals with this podcast as well, just bringing those conversations to the forefront, and now the access of information when it comes to the things that are available to you. I'd love to know, what is it that you do at NITI Aayog, and what kinds of projects you're involved in?
Yeah, so NITI Aayog, is, of course, it's the Indian government's policy think tank. So it works with different government ministries and also state governments on implementing different kinds of policies and programs, also monitoring how they are performing, and whether they are achieving their intended objectives, and what course corrections need to be made. What sort of partnerships are needed with the private sector, with civil society, because government obviously has to work with a lot of other stakeholders. So that is really the work that NITI Aayog does, and within this, what I focus on is on the what they traditionally call the social sector areas. It's not a terminology that I tend to favor very much, because it puts sectors like health and gender and nutrition into just a social category. But I think they are equally crucial for economic impact. And I think, if anything, the pandemic has shown us that if you don't have good health, or you're not doing well on gender, or you don't have good nutrition indicators, ultimately it's going to impact the economy as well. And those are the areas that I would identify as areas I work in. Also sanitation, access to clean drinking water. So all of these are also very linked to each other. And there's a lot of overlaps between all these areas. So I focus on these, and I focus on the government's policies and programs in all of these areas. What are the gaps? What more needs to be done? What is
Mhm.
already in place, how well it's doing, how many people it's reaching, what is the sort of impact on the ground. So it's really very broad sort of spectrum of work, really. It's right from research to monitoring and evaluation, to getting insights from external stakeholders, like I mentioned, the private sector, civil society, building those partnerships between these stakeholders and the government, channeling their feedback and inputs into the government's policy making process. So it's all of those things.
So when you talk about research, is it limited to a certain kind of research, or you work off of secondary data that you get based on the other things that probably the government is involved in?
I mean, it is a lot of it is, of course, government data, because we are mostly looking here at the performance of government schemes, government programs. So, of course, that is the routine indicators that are monitored by different state governments or by the government ministries. So, of course, one tends to look at that. But being a think tank, you also go beyond that, and you also look at whether there have been any external evaluations. Maybe some NGOs have done their own independent assessment of a particular program or a particular scheme, or an international agency like the World Bank, or any other UN agency has done some sort of analysis. So you also look at that. And then you also speak to a lot of external stakeholders, and that's where I was talking about
Mhm.
channeling their feedback and their views into the policy making process. Because I've previously worked in capacities where I have from the outside looked at government programs, and I know that you have a very different perspective when you're doing that. So it's a very useful perspective to have. So being a think tank, we also make sure that we reach out to a lot of these kind of stakeholders, we get their views, so that we're not just relying on the government data, because that's
Mhm.
providing just one part of the overall picture. But to get a much more comprehensive view, these other sources of data or information rather, and some of it might be qualitative, not everything might be numbers. Some of it
Mhm.
might just be a feedback, a perception that people have, and that's equally important, because it's also very important to know how people perceive the programs, and what they think about them, and what they feel, whether there is really an impact or not. So I think it's a mix of both quantitative, qualitative, as well as government and non-governmental data, secondary as well as primary. So I think it's all of that, that one ends up looking at to sort of get a more comprehensive picture.
Yeah, I'm glad you mentioned, monitoring data and sort of, gauging the impact that certain policies or decisions might be making on the kinds of aspects that you're looking at. But I was also wondering, in terms of the general decision-making process from top down, how does the general decision-making framework look like, and where does, NITI Aayog fall into that, the whole structure?
So NITI Aayog, of course, the central government think tank. So it's
Mhm.
at the level of the central government or the union government. And then, of course, you have various ministries, which are the ones which are actually responsible for implementing various schemes and programs. So NITI Aayog sits outside of these ministries, and that is
Mhm.
that is deliberate, because it is a think tank. It's supposed to have a more of an independent perspective and view, or a much broader view, than a ministry which is implementing a program would have, because the ministry would be the
Mhm.
owner of that program. But then, of
Mhm.
course, there's the state governments, which actually also implement most of these programs. The state governments are the ones, which certainly in sectors like health and nutrition, they have the biggest role to play. And they are the ones who actually design most of the programs, implement them. So the role of a think tank in that becomes to really be a partner for them, to assist them in any way, whether it is bringing in best practices or good practices that are being implemented elsewhere, whether it is providing any sort of technical assistance, whether it's helping them to assess the effectiveness of their programs. But our role is more to be a facilitator, a partner, somebody who can bring in that thought leadership, into the whole policy making space. That is really what we do. So our power is of ideas. Our power is not so much of money or funds or being able to dictate the agenda.
Working for a think tank and being surrounded with ideas and doing this research on what the ground reality of things is like, can imagine it can be a very stressful sort of area to be in. So I studied psychology in college, and I remember talking to one of my professors about this at one point, where when you are trying to do this high impact work and trying to be involved in making a difference in the real problems that the society faces, it's something that might take a toll on your mental health as well, or just feeling like the world is full of problems and everything seems so unsolvable and such a large extent as well, right? So do you feel that way with the kind of work you're doing at all?
Yeah, it can feel quite frustrating at times, there's no doubt, because when
Mhm.
you're in this sector, and I think I would say this is not just about being in policy. You could be working anywhere in the development sector, as we broadly
Mhm.
call it, where you're basically trying to implement programs, policies to improve usually some of the most fundamentals of basics of people's lives. So you're trying to get people access to healthcare or education or nutrition, or you're trying to get gender parity in access to basic services. So these are very fundamental things which I think most people working in the sector believe that everyone should have access to. And so therefore, when progress is sometimes not as fast as you think it should be, can certainly be frustrating, because you can
Mhm.
certainly feel like there's too much here which is not going right, and how can I ever be able to really do anything which can address all of this, especially in a country like India, where we have the kind of scale, the sheer scale. So, where we are talking of India, we're not talking of a country. I always say we're talking of several countries in one. And then when you're talking of making an impact and, reaching out to the last mile, and to the person, really the last person who you want should get access to all of these basic things, fundamental things, then I think it is frustrating sometimes. But I think, what you also realize being in this sector, that you just have to keep doing your bit, even if it seems insignificant at the time, rather than getting lost in, what can obviously seem like an ocean of, problems or
Mhm.
ocean of things to do.